Hello, good morning, my trainers and colleagues. Okay, you are welcome to today's meeting. And one of us, our top professor, will be Dr. Ayanniyi, will be taking us on artificial intelligence in ophthalmology. Okay, thank you all.
Hello, good morning. Sorry, the audio is not on. We can't hear the presenter.
You're unmuted.
Okay, can we hear me now?
Yes, very loud and clear, sir.
Okay, I have to start all over. Good morning, everybody.
Good morning, sir.
I have once again thank the Department of Ophthalmology Okay. Okay. So good morning, everybody. Sorry for the disruption. So I have to start all over. Can we see the slide now? Hello? Okay, is it clear?
Yes, the slide is visible and we can hear you crystal clear. Thank you.
Okay, good morning, everybody. I have to thank the Department of Ophthalmology for putting up this lecture, as well as they also have supported the department, including the eye focus, the micronova, and my residents who have worked tirelessly to make sure that we have this presentation. So we are all used to, we are getting used to artificial intelligence now. We might have been using AI application unknowingly, because AI has been with us for quite a while, but is now becoming more popular, and then we are having more applications being unveiled daily into the world market. So I don't have any specific interest to declare, rather than advance of knowledge. I would like to divide this discourse into three. I will first look at artificial intelligence, then ophthalmology. What is ophthalmology? As well as of specific areas or purview of ophthalmology, as well as some selected areas where AI has actually touched ophthalmology. Let's look at the definition of artificial intelligence. Artificial intelligence is advanced computing. It's a set of technologies enabling machines to mimic human intelligence, or machine simulation of human intelligence, enabling human-like performances. Then there are certain areas that AI focus on, like visual perception, speech recognition, decision-making, and translation between languages. Let's quickly look at the history of AI. We can sometimes argue that AI has been with us since inception of the first man on Earth's surface, but there are some specific landmarks that we can refer to when we are talking of AI. I would like to use the summary as presented by University of Queensland. Like in 1642, the first mechanical calculating machine was built by a French mathematician and inventor, Pascal. Then in 1837, the first design for programmable machine by Loveridge and Babbage was unveiled. Then there was foundation of neural networks in 1943. This neural network, when we go further, we'll see how important it is to artificial intelligence. There are a number of tech giants that are working in the field of AI. One of them is Alan Turing. He actually invented what is known as Turing test. Turing test. So which can test whether a machine, the intelligence of a machine. Then the name artificial intelligence was actually coined in 1955 by John McCarthy. There was a meeting in 1955, a conference, Dartmouth conference, where the big players in AI that time, they converged and they met. Then ELISA was introduced in 1965. ELISA has that specific ability to handle dialogue on any topic. And it's similar to what we call the chatbots today. Then in 1980s, we have people like Edward Weinbaum, who created expert system. Expert system, you have experts in various fields. It's like when you say, okay, maybe pediatric ophthalmologist now, you say, what do they do? Then you can package AI app that will be making what they do in pediatric ophthalmology. It's another area of AI that we are going also to talk later. Then in 1997, there was a computer program called Deep Blue. This Deep Blue was able to beat the world chess champion, Garry Kasparov. We are taking time to go through this issue so that by the time we are talking of convolutional neural network, how it is being used for imaging, all these retina fundus imaging, all these CT scan or CAT scan, among others, we'll be able to appreciate that there are backgrounds to all those uses. Then iRobot launches Roomba. A Roomba is like a vacuum cleaner that can avoid obstacle. When it is cleaning, it has capacity to avoid obstacle. Then there was what we call Google built the first driving car, self-driving car, automatic or autonomous driving car. And then it was able to perform the task in a very busy road without hitting any object. Some courageous men and women, they are already entering driverless car, because some people, they are fearing that, what about if the brake fail? What will happen? So those driverless car, they can do maybe all these high speed kilometer per hour. IBM Watson was also on fame in 2011. Then there was a personal assistant in the market since 2011. So this one, there was, I listened to, some of these clerics, when they go somewhere, when they are doing their sermon, they make use of it. I listened to one few years ago. He came to Abuja, pay a visit to somebody, and was telling in his this audio, he was telling people that there are only 3 people that can enter the house: the wife, the husband, and their son. It's like a voice command. They will speak. The AI will recognize their voice, and they will just say, open. The AI will open the door. Something like that is one of these applications. Then since 2018, you have many universities taking up AI as a course. Then around November 2022, what we call today Chat GPT-3 was unveiled. And then those who have been using AI, they know what Chat GPT is. If you give correct prompts, Chat GPT can actually do a lot of things for you. Then in March 2023, GPT-4 was unveiled, which is an advanced version of ChatGPT. Then there are concerns because you see many people are coming up with a lot of what we call apps. There are a lot of concerns around November 2023, and then there was Global Summit where issues or how AI should be regulated, because the way AI is going, if nobody is checking it, human being may create a monster that they will not be able to handle. Then we need to acquaint ourselves with terms like machine learning, which is just a way of training machine. You train machine so that it can behave like human being. Deep learning is a subset of machine learning, while neural network is just a subset of deep learning. In neural network or deep learning, the app is fashioned after human brain. I will show the sketch in the next slide. There's what we call expert system, whereby information from the expert is inputted into the machine, and then non-expert can now make use of that information. Then there's what we call algorithm. Algorithm is just stepwise manner by which you achieve a particular goal. If you want to prepare or cook rice now, you know, you have to get rice, you have to wash it, you have to now put it on fire. Something like that. Stepwise fashion of how to achieve a particular goal. That is what algorithm is all about. If you have correct algorithm, you can actually create an app or a robot that can screen eye condition for you. You can. Then big data, something voluminous, something very large, very huge. But when you now analyze it, you can get what we call patterns from it. Then robots, not robots, robots. They are like messenger, they are like chat assistants. Then robotics, that is a field where robots are being, then generative AI. When you are creating new content, maybe as I'm speaking now, maybe there is conversion to song to video, something like that. You are generating new content, something coding. Those are some of the terms that you may come across when you are talking of AI. This one is just like as if you are mimicking. This one, they are called nodes. This is neural network, which is being applied in AI. Each of these are called nodes, which are processing unit. They are fashioned after human brain, the way our neurons are interconnected. Then this is the brain. When you do mapping of the brain, I will show you in the next slide. You will see it is like that neural network we have just seen. Something like this. This mapping of the brain. There is a way you can prepare this one. So you know that the brain, you have frontal lobes, parietal, occipital, temporal, cerebellum, brainstem, and each one of them has specific function, as shown in this sketch of figure 12. Then this is expert system. You have the expert here. So the information from experts is inputted. You have knowledge base. That's what we call rules engine, where those information are processed. Then user interface, then this is the user, which is non-expert. Then this one is just showing figure 15, just showing the different branches of AI. You have natural language processing, cognitive computing, machine learning, deep learning, neural network. This one is also a sketch of different things that AI is made of. Then conceptual framework. When you actually want to maybe build AI or make a machine smarter, then you acquired a data. This one concerns us. When we are in when the medical record is at his desk, you know, you collect a lot of information. Those information, where it concerns us is that if that information is not accurate, we are going to see the outcome in the subsequent slides. The information being collected by the record officer has to be accurate, because we are using X in the box now. You know, it has saved us of that headache of piling the case files and be extracting data. It's straight into the computer now. So we have ethical issues at that level. We are going to get there. Then data processing. You have to clean that. There are maybe some information, maybe there is typo error, all those things. So you need to clean it. Missing values, is there a way you can refill those missing values so that you have a whole information about particular patient? Then that's what they call outliers. The inconsistencies, is there a way we can look at all those ones before we now say we have information repository? That also concerns us in the clinic, at the nursing desk, when they are recording visual acuity. If what they want to record is hand motion, I hope that hand motion is not written as 660, something like that. So that if we are talking of maybe cataract is causing blindness or is causing visual impairment, we can actually know that, okay, maybe within a year of onset, the visual acuity will reduce to so value, something like that. Because it is, we are talking AI is computer. That is nothing but computer. So it is garbage in, garbage out. When we are talking of biases, when we get there, you will see how AI can be biased, because it is information you give him that it will give you. Then model development. When we are actually designing AI for a particular purpose, let's say we want to design AI now that will be doing edge talk. Is it deep learning or neural network are we going to use? So that is what we mean by model. Then after we have picked particular model that is specific for a particular purpose, then we fine tuning it. Then we evaluate that model for accuracy. Is it, when we develop a model that we want it to be telling us when there is cataract, so that it will not be picking corneal opacity as cataract. So we have to also look at that precision. Okay, it's cataract we want it to detect, so that it will not be picking corneal opacity as cataract, something like that. It's possible, then we validate it. Then development and integration. Integration, how do we integrate it into the edge system? How do we make it interact with the already available things? How do we use it to monitor it if it is not performing well? Then how do we sustain it? All those issues are part of conceptual framework. There are additional considerations, may include the ethical implications, data privacy, bias, accountability. We are going to talk about it in the slide later. Then regulatory compliance. The AI or robot we have developed, is it complying with Medical and Dental Council regulations? Is it complying with NAFDAC regulation? Is he in line with what National Health Research Ethics Committee wants? All those things, we still need to look at that. The user acceptance, the eye ethical professionals, if we develop a certain robot, is it something they will appreciate? Is it something they will approve? Or it will be outright rejection by the eye health carers? Then the patient, is it something that will be frightening them? So then interoperability, you know, AI, there are something we are using before AI become popular. If we want to ship information data from maybe Excel or other program that already in use before, will it be compatible? Something like that. Then types. From here, you will know why tech giant like Elon Musk and some others, why they, I was in March 2023, why they were concerned, why they were making noise. We see now. We can classify AI into based on capability or the way they function. You know, narrow AI, but virtually all AI on the Atlas surface today, they are still narrow. They are narrow. Then general AI, okay, when I say narrow, that is, you can still say they have not matched or surpassed human intelligence. But when you are talking of general AI, they are already surpassing human intelligence. Why super AI? It's like those things you see in the fiction, in the films, they are yet to exist, something like that. Then reactive machine. You can say in terms of limited memory, theory of mind, that's one has to be to do with psychology, emotions, something like that. Self-aware. By the time AI becomes self-aware, it means that when you have robots, that robot can decide whether it's going to kill you or not. That's the fear. That is the fear when they were saying that by the time you make machine to be self-aware, you go, if you tell that machine, you give a prompt or command, it may decide not to listen to you. That's the fear. Those who are in the tech, that's the fear they are having today. That's why there's this noise. If anybody want to call it noise, why they are alerting the world, because their fear is that people may actually inadvertently create artificial intelligence that they will not be able to have control over after some time. Then let's look at ophthalmology. I try to define ophthalmology. Okay, everybody knows it's a branch of medicine. At least everybody here know that ophthalmology is a branch of medicine. But I try to define that ophthalmology concerns itself with heart and science of eye, agency, visual pathway conditions, and pathology. Then it employs, like the core medicine it belongs to, it employs clerkship, examinations, investigation, counseling, medical, optical, surgical, and laser options in its operations. Then can we look at this figure 19? You see this schematic drawing of the eye. You can see the cornea, the anterior chamber, pupil here, then you have aqueous occupying, then the lens, then you have the vitreous, then you have these rays of light going to the eye, then get focus around the macular area. If you like, you can call it fovea. If you want precise something. You know, these rays of light, it has if you now go through some changes, generating impulse, that impulse will now be relayed. Let me go to this. It will be relayed through the optic nerve. Then this is the same axons coming from the retina here that continue. Some cross to the other side, while some continue. It terminates around lateral geniculate body here, as a nucleus, yeah, we'll call it body if you like. So that is one neuron. Then another neuron now take over from here. Then it terminates. You see area 16, 17, 18, called a visual cortex. So it is the visual cortex that will now interpret. Okay, this is a man. This is a cat. This is. So we are going to refer to this sketch when we get to the new thinking now. This neural network, the one already unveiled. Then let's look what constitutes ophthalmic practice. You start from the patient information, patient records. Then you go to history and examination. You know what I mean by patient record is that you collect demographic data of the patient, age, gender, tribe, religion, and so on and so forth. We are using our ophthalmology clinic here, or ophthalmology department here. The patients now come to the nurses. The nurses do their talk to the patients. Then they later do visual acuity. Then they send them to the doctor. Doctor now do what we call clerking, taking their EC, examine them. Then, if there is need for investigation, they ask them to do it. Then they come with the diagnosis. The optometrists, what they do more or less is both investigational and treatment. Because you are having refractive error, they do refraction for you. But they can also investigate what they are doing. Investigation is also part of it. Something like that. Those who have glasses, need glasses, you send them to optician to fix the glasses for them. Something like that. You can those who need the surgery, go and carry out those who need admission, put them on all those things. If you look carefully, if you sit down, you can create an app for each of them. If you like, you can do robots that will be doing each of those activities, something like that. Then you can refer consultation. Then you can use AI to give educational messages. Training, we are going to see one of them. Then research and development. In fact, AI is very, very useful. Those are what eye care practitioner, eye care professional, that is what they involve. So we are going to then, this picture was taken here. We just put them together, ranging from the desktop at the medical record point. Then slit lamp, one of our slit lamp, this is one of our slit, then this automated refractor here. Then the pack scan, the printout from our OCT. Then this is our operating microscope. And then this is CFF. This CFF, they have even gone further. We are going to see what we call ionic in one of the slides. This is printout from CFF. Then this is anesthetic machine. You know, it's computerized. Then you have a Fonda camera. Then let's look at the application. AI is being used for screening and diagnosis. It's possible now to use AI to screen. Then risk assessment and prediction, personalized treatment, image analysis and interpretation, surgical assistance, tele-ophthalmology, drug discovery, patient management and follow-up, as well as education and training. Okay, screening and diagnosis. You can create algorithm. You can actually create algorithm that will detect and classify eye condition simply from images, medical images. AI has capacity to take high resolution eye images from the cornea down to retina. In fact, you can use AI to take images of optic nerve, the visual pathway up to visual cortex. You can use it. What does it do? Because there are algorithms that can do that. What it does is that it has capacity to know this, to actually document the features of retina, the arteries. Let me just call the vessels. It has capacity to take the features of macula. It has capacity to take the feature of optic disc. So it will now, because you are fed into the machine all the normal pictures of those specific areas of interest, maybe millions of it. That's why when you are doing what we are doing, you should also
adjusting the flow of your thoughts for the mock exam. Shemba, in our corner, in our.
You should also cultivate the habit of taking clinical photographs. When your computer that is information to the cloud. Okay, when we get
different,
maybe we'll talk about that. So it can actually classify all those images into normal and tell you this is normal macula, this is normal optic disc. Okay, this is
do what you can
pathological optic disc. It can grade, it can tell you that this is if you are diabetic. AI can do all those from the images. Okay, you can, this one just the visual field defects. So I won't stay much on this, but it's very, very useful. It's just to illustrate that at different level, is it from the retina, is it from optic nerve, is it from chiasma, or is it from optic radiation? The optic radiation, upper loop, lower loop, you are getting me up to visual cortex. You see corresponding, when you do your CFF, you see corresponding visual field defect. And if there is none, it will show you like this one. So at various levels. Then ionic. We have CFF machine that we are using currently. There is app called Ionic now. I don't know if department like or the teaching hospital like, we can acquire it because you have to register, you have to pay. But it was showcased during the last OSN in Enugu. I use it myself. Very, very, very effective, user-friendly. You can, as you are staying in your room, you can do it. You don't need to go to where there is CFF machine now. If you want to use it. Those that are in private practice, they can subscribe. And then they just say their patients should pay certain amounts. But I plead, don't compete with the department for now. Then risk assessment. You can use AI to assess the risk. Maybe you have a family that one of them is having glaucoma. You can now assess other family member or that person that is even having glaucoma, can use it to predict, okay, what is likely to happen if you are not. So personalized treatment, because you have the patient information, you can personalize their treatment. You can optimize their treatment. Then image analysis and interpretation. Using algorithm, you can actually analyze and interpret complex ophthalmic images more quickly and accurately than human. Then surgical assistance. You've been hearing of femtolaser cataract surgery or the laser refractive surgery, then phaco. They are high-tech machines with AI input, advanced computer. So it enhances precision. Then you can get real-time feedback. Then drug discovery. All those new molecules you are seeing, new molecules are all these. If you that in the last five Okay, sorry for the interruption. It was a connectivity problem.
The slide is not showing us selection. That's to go down to the slide. Yeah, yeah. Circulation in the screen, so you can say. I think you That is.
Why is it not showing? Please, are you seeing the slide?
Yes, I can see the slide.
The thing is not responding. Sorry for the break. We have an issue with connection.
People on the Zoom can see. Activate again.
Well, why is not responding? Put your own one slide so.
Sure.
Your antenna is unstable.
You choose to go this and go again. If it works, hotspot is fine.
It's not even showing. Okay, which one is that?
This Galaxy.
Galaxy, okay.
You can connect. It's connected.
Okay. Let me see whether it's really. Let's connect first.
It's connected. So I can show you the screen for the Zoom participant.
I hope this one will not disturb it.
No, it's pretty stable.
Okay, let's see again. Share.
This one, share this one, this. Yes, and then share. Yeah, we are back.
Okay.
Let's show them. It's showing her.
Good morning once again. I hope we can now hear.
Yes, sir.
Okay, delay. Okay, we can now continue. Education and training. We have AI-powered simulation platforms, which are being used to train ophthalmologists and medical students in complex surgical techniques and diagnostic skills. This simulation platform, they are very safe, risk-free. They allow the trainee. So is it commit mistakes this time around, which may be very, very costly in human. Then it's offered tailored feedback. That's what we call realistic scenarios, enhanced precision competence in surgical skill. Although then all these things, they are inbuilt into the simulation platforms. Okay. So I would like us to watch this video. I don't know why the audio is not on, because it's as audio. This thing is funny. It has audio. Why this thing?
These 3 days, maybe it's good. But, yeah.
Okay, what I want you to appreciate in this video, which regrettably the audio is not playing. There's what we call Help Me See Madagascar Laboratory. One of our senior trainee ophthalmologists was there around early this September. Around that time, we were doing OSN conference. Essentially, you have what appear like a robot, where you have simulation on cataract extraction. Essentially, you can see that this simulation is on CCC, curvilinear capsulosis. So it's simulating CCC, curvilinear capsulosis rather. So you can actually not see any physical high, but that is what we call it here. Real-time factual simulation. So unfortunately, because if you hear the audio, you will just appreciate it. But it was supported by FMC. They have 11 laboratories across the globe. The one that is nearest, or you can say it's Africa or it's in Madagascar. You can picture where Madagascar is on the world map. And so one of us went there, and then it was kind to have sent me this clip. Maybe at appropriate time, when maybe when we have one of our sessions, we can see whether actually okay. That's what we call fission recovery. Maybe a week or 2 ago, one of the world tech giants, Elon Musk, was able to tell the world that actually is one of the co-founders of what we call Neuralink. So Neuralink has successfully been used to actually treat somebody who was paralyzed from the neck downward. According to the information available, that person can now use his hand to control mouse, do some activities after they make use of this Neuralink application. It's like you plant, you see, microchip, and then it was able to move maybe his finger or something like that. But the one that is very important to us is the realm of ophthalmology, where Elon Musk claimed that the blind sight, the name of that application is called blind sight device. It will enable those who have lost both eyes and their optic nerve to see, provided their visual cortex, I saw visual cortex the other time, provided their visual cortex is intact. Maybe those who have lost their vision from glaucoma, all these maybe trauma, maybe in some traumatic cases, the optic nerve can actually see fat. But the visual cortex has to be intact. So let's wait for that company and see whether they will be able to help us to sort out issue of blindness for some of our patients. This is Elon Musk with some of his associates. Then this is the person that had a motor accident and was paralyzed, but now can do some. Then this essentially is like Google or whatever. In this Google, you have some micro camera that can actually capture the picture around. Then the added advantage of this, the one being unveiled by the Elon Musk and associate, is that you know that what we call visible spectrum. When you look at electromagnetic spectrum, there is part of it which is called visible spectrum. This is where normal human beings are supposed to be able to see all these colors. If you flash your mind back to O-level physics, Roy Beef, you can appreciate red, orange, yellow, indigo, up to violet. So Elon Musk was telling us that the person will be able to see ultraviolet and infrared up to even radar. I don't know whether those people that will be wearing that spectacle will become another Solomon. You know Solomon? If you know the story of Solomon, they said that he was able to communicate with Alijanu. You know what they call Alijanu? He was able to send them on errands. To send them on errands. Maybe those that will be wearing this spectacle, they will be able to see those things that you cannot, it's not possible for human capacity to appreciate. Then let's just quickly, I know we have spent a lot of time, including the one caused by loss in internet connectivity, AI ethics and ophthalmology. Honestly, we should take this one very, very serious, because you know AI is still evolving. And then I will even call it bioethics, because bioethics and ethics, they are different. Ethics is essentially traditional, while bioethics take care of all evolving things, both now and the future. Bioethics is much more encompassing, but it makes use of reasoning, logical reasoning. You can have a position on a certain thing this morning. If somebody before the end of today bring another very logical reasoning, it will displace that position. So it's still evolving, but there are areas that I want to sensitize you. The issue of machine training ethics, the issue of machine accuracy ethics, the issue of patient-related ethics, you know, the patient ethics is already known, very known. But when you are now using AI on patients, there are certain ethical issues that is generating. Then physician-related ethics or health worker-related ethics, because the care of patients is not done by only physician. So we have to pay attention. There is what we call sheer ethics. Those things that border on everybody, whether it is machine, whether it is physician, whether it is nurses, whether it is pharmacists, whether it is optometrists. Then role of regulators. In Nigeria, we have regulators. You have Medical and Dental Council. You have NAFDAC. You have what we call National Research Ethics Committee. You have maybe Nursing Council. You have Optometrist Council. You are getting what I'm saying? Those are regulators. Okay, now, machine training ethics. How do we protect data? Who owns data? You are getting what I'm saying? You know, the information of the patients, the confidential issue arise in two places. As at time you are collecting information, you that is collecting information, the medical record officer that is collecting information, the doctor that is collecting information from patient, there's issue of confidentiality at that level. Then when you are now transfer, you have your data repository already. You know, when you get information from the patient in the clinic, in the theater, or in the ward, it's being archived somewhere, it's in the box. Then you now want it to make use of it in creating a robot or machine at that level too, in transferring information from wherever it's in the box is keeping it to whoever, or sharing it with whoever is going to use it. That's two level. It's very important. Something is done. Then that's what we call the machine accuracy ethics. That is intelligibility, the transparency. You know, we are talking of transparency. Transparency is an issue when you are talking of ethics. Okay, you just bring something that looks like a machine, but what that machine is doing, you don't know it. How many of us know that you just ask patient to put his chin on the chin rest, put his forehead on the forehead rest, and then you press one button, and that machine is taking picture, is taking pattern. You are getting what, generating pattern, and it's telling you this is this. Do you know how it works? That is transparency. But that transparency too, if those who decide that particular machine, if they say, okay, we need to let these people using it to know it. You know, there's problem with that too. There can be, they can steal that technology. They can steal it. Somebody can be, there can be cyber attack because somebody understands. So those are ethical issues. Then there is what we call black box phenomenon. You know, it also borders on what we call that complexity something. Am I going to reveal all the knowledge of how the thing works? Or I'm just going to put you in the dark. Then there's biases. And you know, I mentioned it at the beginning that when you are collecting data, it is what you feed in. If you don't feed in appropriate data, your computer will be biased. All those machines you are using, they are biased, whether you like it or not, because most of the information they use to train those machines, they are not from here. They are not from here. Then we talk of, you know, the more intelligent the machine is, the less accurate it is. And the more accurate it is. Maybe we'll devote a time to look at this AI because it's a lot of discussion. Then patient-related ethics. What is liability? What is culpability? Who is liable? Who is actually liable? When you are using machine, is it the company that produces it? Or you, if the company fail to disclose all the defects associated with the machine, if it just tell you, you can generate information about the visual field loss and fail to tell you that after the patient is exposed to it, maybe it's going to develop one cancer. You are getting me? And then patient now is traceable to the machine use. Who do you suppose to be culpable or liable? Then when you use a particular machine, you are liable in the sense that any information generated from that machine, you believe it hook, line, and sinker. And then you now tell the patient, no, from this OCT printout or from this CVF printout, you don't have glaucoma. You can go and have your pandemic. And then maybe 3 years later or 5 years later, the patient come with visual loss, significant one, because you have assured that patient is not. So you are liable. Those are issues bordering on ethics. Then issue of data sourcing, AI development design is also ethical issue. Then standardization. Though, like I told you, AI is still evolving. How do you standardize AI? Are you going to make AI generated information now gold standard, or you are still going to be using human applied knowledge at the gold standard? Those are the issues. The issue of skill loss, dependence, they are also part of what people are looking at now. Like you create AI that can do cataract surgery. Those who are the skill surgeon, over time, they will lose their skill because there is machine doing it now. I cannot, except maybe few of us that are in private practice. When I train, I was doing refraction myself. You are getting what I'm saying? Because optometrists, we don't even have one in the department that time. It was only Kwara State government that has one because we are using general hospital sites that time. So sometimes we send patients to them. But most of our patients, it is we that normally do. How many residents are doing refraction now? You have optometrists, you have automated auto refractor. You are getting what I'm saying? Over time, that skill will be lost. That is one of the ethical issues. So because you are now depending. Then the other one is that job replacement. AI is likely to replace a lot of us. But what I want to allay your fear, because we have discussed this over and over again at different fora. You don't need to fear anything. We concluded that those who will be affected are those people who are not AI upgraded. If you are AI upgraded, in fact, you will be talking, the way you will be talking, you won't be talking of whether we don't allow somebody to power cut. What you'll be talking is how to create her, because you have the knowledge. You can generate algorithm that, okay, I want to have robots that will be where the nurses usually do their hair talk. I want to generate robots. Maybe you generate robots that will have information on cataracts, all those information that nurses usually give. That will generate information on glaucoma, that will generate information on ocular injury. You are getting me? So you keep yourself busy rather than be having a headache that one AI will take job from you, something like that. I remember many years ago, we went for this revision, clinical ophthalmology revision, and then Dr. Ajayi Oba, Professor Ajayi Oba and me, in national, we refer to everybody as doctor. So it was the one that gave us that lecture. I think it was on cataract. He now put a poster that what will happen to us if somebody discover drug or medicine that will prevent cataract formation. You are getting what I'm saying? Then AI tools. So I have a list of AI tools that when you interact with them, you can go places. But what I would advise every one of us is that when you use AI tools to generate information, you must hone up. Like, let's say you use it to write an article. After your conclusion, before you start your references, you can say this section is AI generated, something like that. You hold up. In fact, you can specifically refer to a party, okay, ChatGPT, Copilot, Gemini. You are getting what I'm saying? So we can organize lecture if you want, how to use some of the, or demonstrate how to use, because time is gone. We cannot be doing that demonstration now. So research, image creation, video, new AI tools. As I'm talking now, there's what we call a cool that you can use. You can superimpose Chiroma face on my face. No. And Chiroma will appear as the one delivering this lecture. You are getting what I'm saying? What we call Photoshop. Then conclusion, AI is revolutionizing ophthalmology by enhancing diagnostic accuracy, improving treatment outcomes, expanding access to care, and advancing our understanding of eye diseases. However, ongoing research, validation, and integration into clinical practice are essential to fully realize the benefit of AI in this field, while addressing ethical and regulatory considerations. So thank you.
Okay, thank you, Professor Ayanniyi, for that very illuminating lecture. I'm sure that if you had more time, you will have, given us more information. But we've learned a lot from that lecture. I think we'll continue to build on that. I will leave the floor open now for those who want to ask questions or make contribution to the lecture.
So anyone that has no following in crowd, you have to speak up your hand.
Those online can indicate by showing of hand, clinic hand.
Good morning, Dr. Balogun's hand is up.
Good morning, ma.
Thank
We are preferring having you.
you. So, can I go ahead?
Yes, ma.
Good morning, Prof Ayanniyi and the entire house. This is really great. As I was listening, I said, yes, our Prof has taken a different level, not just ophthalmology alone. So we thank you so much for educating us. We are looking forward to more. My question is on Ionic. Does it have within it a system of carrying out the patient's refraction? You know, at present, the CVF, we are doing the CVF with patients near correction. So does Ionic have that input? Because now patients are going to be doing this from home. Thank you.
Thank you, ma.
Okay.
Maybe I quickly answer. I have limited exposure to, although I tried my hand in Enugu during the conference, but I've not have time to actually look in depth. But I suspect it may have that component or capacity to do refraction. But the one I did was not having refraction component, maybe because there are so many people who also wanted to try their hands on it in Enugu. But we can Google it.
Thank you very much.
It's available online.
Yes.
I think I gave in this lecture there is www.ionic.org or .com, something like that.
Yes,
so
thank you.
We can Google it and also access some of the facilities.
Yes.
But it's quite a great application because one can do it at its convenience, it's user-friendly. Having said that, I have no interest Thank you, ma'am.
I think with that, okay, I know what you mean by saying you have no interest now.
No financial
Yeah, exactly.
association, nothing.
Yeah.
It just knowledge and then for treatment sake. No,
which is very good. It will help everybody really at the end of the day. Thank you so much, Prof.
There's a question on the chat box.
Okay.
We've got a question. What's the place of AI in Part 2 research? Are there do's and don'ts?
Okay, thank you so much. There is a question here. What is the place of AI in Part 2 research? Are there do's and don'ts? Without prejudice to the postgraduate colleges, because I know there are information already in the public domain concerning this position. I know how our seniors have been emphasizing, our teachers have been emphasizing that residents will do as much as possible to do something they can own up to. Perchance, any resident use AI for his or her dissertation, that particular resident should be able to review it, not just garbage in, just let's say, okay, you generate your title, you generate your literature review, you generate your methodology using AI app. You should sit down and review it, because I remember vividly during postgraduate exam board meeting, it was issue that was well discussed, and I want to believe that since examiner are scattered across training institutions in the country, they must have shared that concern with their trainees. I want to believe that no resident would just say, okay, I've stumbled on a goal, and then start just send their proposal or send their finished dissertation like that without doing a proper check, dot their I and cross their T before they release it, because there are what we call AI checker in the public domain too. So if you are using AI, make sure that you check everything. Then if I should guide, give a rough guide, there are some, can I remember some of these, but there are allowable percentage of your work that can be AI, like in medicine and related area, up to 35%. Then maybe in arts, maybe up to 20%. I think all this engineering, maybe up to 40%. That's a guide, a rough guide. But you can ask some of your trainers to also guide. But it also borders on ethics. Plagiarism is a very key issue in AI-assisted work now. So it's better to be on the side of caution than just say, okay, you are using AI and then now populate everything with AI. You can never tell. Your examiner may decide to check some of the literature references to find out whether they are actually correct or not, because AI can confabulate. We just bring all the information from anywhere, information that are not necessarily correct. So you have to, when you generate it, read through it and make sure that the information you are getting are actually correct. Thank you.
Sorry, I just want to make a comment. You mentioned about this self-awareness thing and the fear of AI now misbehaving and even probably deciding to kill its maker. You know, I watched a movie a long time ago, even though it's an Indian movie, but someone created a robot, and eventually, and several other ones. And then the robot eventually became self-aware and fell in love with the man's wife, kidnapped the wife, and took over everything. You know, so this issue that everyone is afraid of, I don't know how it's, you know, whether they're making efforts to navigate around it. Because if it now becomes a huge problem, then we'll all be in trouble. And for those who are, you know, thinking about everything is AI, if there's no control, you know, then it's going to become a big issue in future. And then, of course, secondly, all these what do you call it? These tools you have given us. I think we have to have another session where you give us some idea of how to use the various tools. It's also important. It's not just the lecture. I think it's good to know how to use it. So I think the Chief President will create another particular platform where we can have, even if it's a short 30 minutes lecture on how to use these AI tools, so that we don't lose our jobs eventually.
Thank you, HOD. Thank you, HOD. Your concern is well noted. And then I believe strongly, like that meeting that was conveyed, I think November 2023, you know, you have major players in the tech world, including USA, China, well, about 29 countries. They gather together to actually consider to voice out the global concern why AI should be regulated. Why do we have medical and dental practitioners in Nigeria? Even those that were properly trained, we regulate them. Talk less of people that may not necessarily be well trained in artificial intelligence, and then but they have capacity to actually maybe make up. So it needs to be regulated. And since it is evolving, it's a concern for everybody. It's a concern for those that are actually in that field. And then I think the world is already taking steps toward regulating it. Because somebody can just, okay, let's look at all this genetic engineering. You know, there was this, is it RAM, that was created through genetic engineering some years back. You know, there were concerns expressed by ethicists, the medical world, and the stakeholder at that time, that you can't just be creating things. I think people will not just keep silent. Definitely AI will be regulated. Thank you. Thank you.
Any more concern? Comments and questions?
Hello.
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 Good morning.
Yes,
we can
I've been
hear
raising
you.
my hand. I've been raising my hand for some time.
You have the floor, sir.
Well, good morning, everybody.
Good morning, sir.
Good morning, sir.
I'm so happy that I joined this lecture. Very
We are
illuminating.
privileged to have you, sir.
Yeah.
That is our chairman, Faculty of Ophthalmology, National Postgraduate Medical College.
What I actually want to pass along is the question on part 2 research.
Yes, sir.
It is a very pertinent question. And I think you have answered it to some extent. But I must say that, like you said, everything is in the public domain. The teachers and the college is aware of AI. And so what we want to test in trainees is not ability to use AI. It is not ability to use AI. Therefore, if any candidate depends virtually 80% on AI, is doomed to fail. He may even be banned from the exams. In other words, you have to be very careful. You can use it as your template, but like he said, you must now rewrite whatever you got from AI, rewrite it in your own language, because AI language is easy to know. It's almost perfect. And we know that human beings are not like that. So your communication must reflect your personal communication. You can use it as a template to start with. It will guide you. But for God's sake, don't send it like that. If you do, it is usually very easy to spot. And I must warn you, every section of the research carry appropriate marks. AI can wrongly input things into whatever it gives you. If you go to references, it can conveniently put wrong references, even references that does not exist. AI can put it. So if you write your references and we go through it and we discover many of them are wrong. For example, if you say reference number 10 is so and so under your reference, and what is discussed under reference 10 in the body of your knowledge is different. AI can do that because it can create what does not exist. It has ability to do that. So it will look very smooth, but a lot of misrepresentation are usually included. So that is number one. Number two, of course, the college has AI detector. So candidates must be very much aware of that. If you carry AI product and bring it, you can be sure that it will be discovered. And when it is discovered, the appropriate sanction is outright failure. Sometimes if it is too much, you can be banned from the exams because that is fraud. That is pure fraud. So that is the information I have to give. Thank you very much.
We are privileged to have you, sir. Thank you, sir. So we've heard from horse's mouth. Fabrication is one of the ethical misconduct in research. Plagiarism.
No chance. This somebody's person.
Just tell me, the person putting up his hand, can he talk? Go ahead and talk, please.
Good morning, everybody. This is Okoye from UNT, Gwagwalada. I want to thank Professor Ayanniyi for a very insightful presentation. And also, I want to reinforce what our chairman of the faculty in the National Postgraduate Medical College of Nigeria, Faculty of Ophthalmology, Dr. Ajibode, what he has said. Yes, there may be nothing wrong with using AI, but we must learn to use AI responsibly and ethically. You understand? Because we also must realize that AI should still be subject to human oversight. AI is subject to a lot of errors. It's not perfect. We are not there yet. So we must be very careful if you're using your AI tools, whether in practice or your dissertation, research, or whatever. Even in daily life, you must still know that this technology you're using is still subject to a lot of errors. And then there are policies guiding use of AI in higher education and in research. So I would implore all of us to make out time, search for those policies, the documents. That's one by UNESCO. There's another one in the country, the National Artificial Intelligence Strategy. And I'm even aware the NUC level, I think people are already making inputs into the policy for AI use and application in higher institutions. So I just want to pass across that information to all of us. Thank you very much.
You are drunk.
Dr. Okoye.
You are drunk.
From University of Nigeria. So it's one of our lights in ethics. It's an ophthalmologist and a giant in ethics.
Okay. So on that note, I want to thank everyone for finding time to attend. On that note, I would like to thank everyone for finding time to attend this meeting, and to thank our lecturer for a well-delivered and insightful on a very topical topic like AI, which as we've seen, is the application is just vast and very much applicable in our practice. So thank you very much, everyone.
Thank you.
We're no longer